Hello, everyone, and welcome to this week's episode of Let's Talk Shop. I am Debbie DiMartini, certified clinical thermographer at Thermal Body Scan in Santa Cruz. And today I really want to talk about dental pathology and cancers, diseases in the body, systemic disease. There is a direct correlation, many research studies are showing, in oral pathology and systemic disease. In particular, I'm doing this episode because I've had a lot of patients recently that are seeing a gentleman named Dr. Robert Dowling. He's with the North Carolina Institute of Technology, and he's done a lot of research, extensive studies about correlations between breast cancer and oral pathology. In fact, one of the things that they're finding is that almost all of the breast cancers that they're seeing in their patients are occurring on the same side as the dental pathology. And when I'm talking about dental pathology in these cases, I'm really referring to more significant things. Certainly there's question about silver, mercury, amalgams, fillings, causing toxins in the body. But what we're really talking about here are things like root canals and teeth extractions, wisdom teeth removal, things that cause cavitations, which affect directly the bones in the jaw. So what can happen is those pockets or cavitations will really be kind of a harboring breeding ground for bacteria and microorganisms. And the body, with its lymphatic system and bloodstream, carries those toxins and microorganisms throughout the body, affecting organ systems that are located farther away from the mouth. The liver in particular is one of the filters in the body, and those lymph drainage patterns pass directly by the breasts. So you do kind of have to wonder, this does seem to have some relevance. Certainly there's a lot of studies that are saying exactly that. One of the things that Dr. Dowling states is that neurodegenerative diseases, things like Alzheimer's, ALS, MS, Parkinson's disease, those are all right-sided oral pathology diseases. So there's a correlation with a multitude of diseases. The Center for Disease Control, just doing a little bit of information gathering for myself, talked about periodontitis, which is gum disease, and that it's directly linked to diseases like diabetes, heart disease, stroke, premature and low birth weight babies. So there's a lot of compelling research that I urge you to go out there and find. This is certainly something that in Western cultures especially we see a lot of dental intervention going on, and it kind of is, now that we've seen this for years and years and years, we're taking a step back and kind of reanalyzing, maybe there are other ways certainly of going about looking into these dental pathologies so that we don't affect other organ systems in the body. Certainly with thermography, we can see inflammation in the body. In fact, I'm going to hold this here and show you my little screen behind me. This gentleman has some sinus issues, but you can also see that his mouth and all of the area underneath his chin and up to the collarbone area is all very inflamed. That is actually an infected tooth that showed up on that scan. So with thermography, it's very easy to detect increased heat patterns, which is associated with inflammation. One of the things that we can also detect with thermography is there are markers that show us if you have elevated C-reactive protein levels in your body. C-reactive protein is a measurement, it's a blood test that can be done that will show how much inflammatory response you have in your body. So when you're dealing with someone that has a lot of systemic inflammation everywhere in the body, that's a precursor to most diseases, and this we know for certain. They say that C-reactive protein is the silent killer, because if you've got a large amount of inflammation occurring in the body, you are much more likely to have disease. And thermography, because we're looking at heat patterns, can show us these things sometimes years before you're symptomatic. So I urge you to do your research, look into thermography. It is a safe, no radiation, painless, inexpensive test that can shed light on many of these things that people are dealing with. Again, this is Debbie DiMartini with Thermal Body Scan in Santa Cruz. We do breast thermography, full body thermography, and area of interest. So we are a full one-stop shop. All of our scans are interpreted by board-certified medical doctors, and you do get a report back that is sent to your physicians if you prefer, or to you, that details the thermographic findings and interpretation. I urge you to check out my website, www.thermalscan.com.